An important deadline is coming up this week. Open enrollment for the Washington Health Exchange ends December 15th. To help you navigate your options to sign up for health insurance coverage through the Affordable Care Act, we have Gary Franke with us, a local independent health care broker. Thanks for being with us, Gary.
Yeah, thank you for having me on.
All right, I know health insurance, things like that can start to get a little bit scary for people figuring out things, but where can they start in terms of looking at their options for health care?
So the first step is the Washington Health Plan Finder. Washington State has their own state-based exchange. So you go to the wahealthplanfinder.org. You can give them a call. The best way to do it is shop around and call an independent agent like myself, and we can help you look up your doctors and prescriptions and the facilities you want covered.
Okay, and then how can people apply? Do they go online to do that? Do they call someone up?
The best thing to do is to go on the Washington Health Plan Finder site itself to enroll. But if you get stuck or have questions, you can call an independent agent or the Health Plan Finder themselves. The one key thing is the Find a Doctor tool on the Health Exchange for prescriptions and doctors is not the most accurate. So you always need to look them up on the carrier websites.
Okay, so an extra step there. And in terms of financial help, if people are concerned, what's this going to cost me and my family, is there any financial help?
Absolutely. So under the Affordable Care Act, the price you pay for health insurance is based on your income for 2023 insurance. So you need to project ahead what you're going to be making or approximately what you're making at this time. So if you're lower income, you may get free insurance or discounted insurance. So you get fairly substantial subsidies.
Okay, and for people that might be shopping around a bit, you and I chatted earlier, you might be surprised you could end up saving some money.
Yeah, I have some families that even if you make up to 150 or 200,000 in your larger family, or if you're in your 60s, they phased in a lot more tax credits in the last few years. So the tax credits are a lot more aggressive than they used to be. So put in your income, apply for tax credits, and see what it tells you on the screen.
It doesn't hurt to look and doesn't hurt to ask questions. All right, Gary Franke, thanks so much for being here with us. Remember that deadline to apply for health insurance through the Affordable Care Act is on the 15th. That's coming up this week. Thanks so much, Gary.
Thank you much.